Hey everybody, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we are getting the scoop on some big news coming out of Vida Health. We are talking to Dr. Pat Carroll, their Chief Medical Officer, about the fact that Vida has now launched a musculoskeletal care program. So jumping into the MSK space to round out the other great chronic condition care that they provide for diabetes and mental health. So Pat, great to have you here. It feels like you were just on talking about prescribing. So, I mean, lots of exciting stuff happening.
Yeah, we're moving fast
It
and
looks like
intentionally.
it.
Yeah.
So I've got to hear about this MSK move because this was a little bit unexpected for me. So I mean, I've been following the digital health chronic care space for a while now, and there was kind of like an arms race early on. I mean, and we saw Omada Health acquire Physera, we saw Dario Health get Upright, and so it's like incorporating these companies that were already providing MSK care, into their businesses. You guys have kind of waited this out. So I mean, what precipitated this move right now? I bet there's a lot of speculation out there that this is just to check a box in an RFP process, but I know you guys better than that to know that it's not deliberate. So what made you guys jump into this space?
Yeah, it's definitely not check a box. It's really responding to our customers, which are really important to us and their team members, particularly in the employer space. So what they've come to us and said, we love Vida's holistic approach for both mind and body. One area that we feel that you folks could add some value in terms of providing access into an area that we see a pretty significant spend is musculoskeletal, specifically around acute and chronic low back pain. So we decided that we definitely had the capabilities. We brought in the expertise to examine it and then launch in this space focused on low back pain. So we're really excited to launch. It's really in response to that customers looking for that holistic as opposed to just point solution in that employer world particularly.
All right, let's dive into this. I want to hear all about, exactly what the offering is. So I keep hearing you say lower back pain. So is that what it's for? It's not like a full-on hinge or sword that's, doing everything A to Z as far as pain is concerned, knees, hips, everything. So it's just lower back.
Absolutely. So when we looked at where the spend is and where the disability comes up, a lot of it is around a low back. There's a reason for that. Is first of all, it's very common. 80% of Americans in their lifetime will have a low back pain issue. So it is out there. If you actually look at the numbers, over a 10-year period, over $134 billion have been spent in acute low back pain, in chronic low back pain. So it's something that's prevalent. It's something that's costly. Employers are looking for their team members to get back to functionality and help work through it. So we decided that that was the one area we wanted to start with because it is so prevalent, so costly, and there's a major access issue. What all the research shows is the one intervention that you can do for acute low back pain. It's not necessarily medications. It's really getting physical therapy up and running sooner rather than later. If you actually look at acute low back pain, 90% of folks will improve over 12 weeks, but we can speed up that improvement by intervening sooner with physical therapy.
All right, so tell me a little bit about how you guys have designed this, because I mean, I know the focus on integrated mind-body care, and so I'd like to hear how this is designed, and also if you can talk a little bit about, too, like what parts of this are virtual, what parts of this are self-directed, which parts of this involve clinicians, like give us a sense of like how it's designed.
Right. So we designed it to be fully integrated with everything we offer. And there's a reason for that too. If you actually look at conditions like obesity and diabetes and hypertension, they have a significant higher prevalence of low back issues with those conditions. So it fits really nicely into our cardiometabolic offering. It also fits very nicely in with our mental health offering. All of the virtual physical therapy companies that have launched, when I see what they offer, they are now starting to integrate in things like PHQ-9 and GAD-7 screens when someone comes onto their platform. Why? Because there's a big interaction in terms of improvement to functionality and where you are in terms of mental health. So everything that we do actually ties in with that. So we fully integrated this into our offering, into our app. So let's just go through a customer experience.
Yeah.
We work with an employer, and they have a team member with a low back issue. They come on to our platform, and they are educated right from the get-go about what back pain is, what we can manage, and what will require referral off. So we do a really intentional screen, such that if someone has a neurologic deficit, if someone has significant surgery or significant other conditions going on with this, like a fever, anything that will disqualify them, we will pick up in our screen, and then our care navigators will actually refer them off either to a partnered, physical therapy company, and we are investigating partnering with the bigger players in the space in terms of referring more complex patients off to them. And we will end up with a percentage of folks who are really appropriate for our program. And our program is such that the first visit after the screen is actually with a physical therapist who actually screens, reviews the conditions, and then sets up a treatment plan. So we have an expert weighing in on what the treatment plan should be. And then within a short period of time, within 48 hours, they're actually assigned a coach. And the coach is their key person. This is a coach that's trained in what we're trying to accomplish in terms of treatment and evaluation of low back pain. And they meet with that patient every week, and we come up with a customized treatment plan. 6 weeks is really about the acute intervention. We have over 140 video content that we developed, looking at specific exercises depending on what your low back pain issue is, and stepped up progression of physical therapy, with the guidance of the coach, and always the possibility that they may need to be referred back to that physical therapist for reevaluation. So that first 6 weeks is that they're really immersed into a virtual physical therapy program with really targeted content and a customized treatment plan. And they're checking in with the coach every week, and we're grading things like where they are on their pain scale. We do an initial pain scale evaluation to start with, and then we follow along through the course of the treatment. Also, when we do the intake, we're doing that PHQ-9, we're doing the GAD-7, and if we identify significant mental health issues, we'll get them plugged in with our mental health program. So it is really a holistic approach. If, for example, they come on and they're a patient with diabetes and they have acute low back pain, and we identify the diabetes is not under control, we'll bring them in through our cardiometabolic whole health program. So it's really integrated totally into our program. 6-week initial virtual physical therapy with coach guided, and then a 6-week kind of recovery transition back over that next 6-week period. So it's a 12-week, very intentionally designed program that's going to return folks to functionality. And quite honestly, during that treatment course, if things change, if some red flag symptoms come up, we'll get right on top of that and refer them off the platform.
All right, so this sounds like it's incredibly targeted, and there's an incredible finite period of time here that a member is engaged for this particular type of care for just low back pain. And I'm curious, if you can tell us a little bit about the strategy, just even behind that decision. I mean, because as you mentioned, you guys are looking at some of these big virtual back pain clinics to partner with. Why not just have the partnership be the partnership? Why go through the trouble of creating this program? I mean, it sounds like it's incredibly robust. 140 different pieces of video content. I mean, that's a lot. That's a lot. So why go through that process of building this out as opposed to just straight up partnering or acquiring somebody like we saw some of these other chronic care companies do to just build some of that in and fast track it?
Yeah, so getting back to our customer, they're asking us, can't you just offer this at a certain level so we can integrate it all in and we don't have to go out for another point solution? For some customers, that's what they want. Others, of course, and we understand this, say, hey, we love your mental health and cardiometabolic programs. We got the MSK. We're going to partner with one of the big players on that, and we're okay with that also. I think to look at what we do, it's really on the customer demand. They want immediate access. And we are kind of that entry point into the treatment of acute low back pain, with the understanding, and we're very clear with customers, is that we identify higher acuity patients who are not improving. We have the ability to refer off to either brick and mortar physical therapy sites, and we're exploring partnerships with some of the bigger players in MSK to refer into their system. We realize that's not who we're going to be. What we're is a totally integrated experience who can manage a high percentage of acute low back pain in a really thoughtful, evidence-based way. So it's really from customer demand, Jessica, to get back to why we decided to do this.
No, I love that. And I want to ask you, Pat, I guess we're going to wrap this conversation up about that customer demand. I mean, I feel like, as we've been watching, the digital health, the virtual care space unfold and especially grow over the last couple of years as a result of the pandemic, I'm curious, what your thoughts are, the fact that you're even getting asked for this within the solution that you guys have already developed over there at Vida Health. I mean, it's like, what do you think this might indicate about the larger trend here on adoption for virtual care? I mean, I'm already hearing, and we've been hearing it for a while, death to the point solution. And we are seeing more platforms and companies like yourself even start to pick up other aspects of care to platform themselves out even further. But I mean, what is like the key takeaway for you on the fact that your customers are asking for this now?
I think it's that trend towards, the one-stop shop, the holistic solution. But employers really care about their team members and they want the best level of care. And they trust us to say, this is what we can do up to such and such a point, particularly around MSK. And for everything else, we're going to get your team member the right level of care with the right organization. In many cases, we can handle all of the acute low back issues. Again, if you don't do anything, 90% of these folks get better, but we can expedite that, healing process by getting physical therapy intervention early and giving them that access to care. But we've also, partnered with great employers who realize that if we find that they need a higher level of intervention, we have ways to refer them off. So I think it's the demand, the access demand, the getting beyond point solutions, something that's totally integrated, which it is, and a recognition that there's such a crossover between the cardiometabolic conditions, the mental health conditions, and MSK, particularly with back pain. They get that, and they love that integrated solution.
I love that. All right, and this is rolling out, right? Or it has rolled out. You guys have this with an employer? Are you a couple yet, or what?
Yeah, we actually launched this July 1st, so you're
Awesome.
catching us a little bit late here.
I mean, Pat.
With a major Fortune 500 employer who have team members across the country, so we're able to service across the country, and we're really excited about partnering with them, and have had a lot of interest and demand from other employers who say, wow, we didn't even realize you guys offer this. Let's talk about it. And so we're in that conversation going back with our current customers and saying, hey, just to let you know, here are our capabilities. If you're interested, let's have further conversations.
All right. Well, further conversations for us await, I am sure. I don't know what you're going to do with the next 8 weeks, but I feel like I keep talking to you at 8-week intervals here. And every time I talk to you, you guys have something new going on. So that's really exciting. Thank you so much for dropping by, letting us know all about the new MSK program. I think that's really cool. It's exciting to see you jump into this space and do it in a way that really fits within that whole Vida Health integrated mind-body approach. I love it.
Great. Hey, Jessica, great chatting again. And stay tuned. We're cooking up a lot of really interesting things over here.
I can't wait. I cannot wait to see what you do next. All right. Dr. Pat Carroll, the Chief Medical Officer over there at Vida Health. Thank you again for joining us. I'm Jessica DeMassa, and for more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It is youtube.com/WTF Health. Talk to you guys real soon. Thanks again, Pat. We'll talk to you soon. Bye.